Sarah, with you, if that's okay. Let's just, all of us, understand the scope of what we're talking about here today. Nearly 2 million of our neighbors rely on federal health care programs, Medicaid being the gorilla program, but far and away not the only one. So these are seniors, they're children, they're individuals with disabilities, their entire families whose access to health care is now literally in jeopardy. These are patients who are fighting cancer, who they may now be required to work just to keep their coverage as opposed to being focused on their recovery. They're children who could lose access to life-saving medications and treatments. Seniors who may find themselves suddenly deprived of the home and community-based services they and their caregivers rely on. And this is the part of the story that I think is undertold, if I may say. These cuts will not only, we too often are in a them versus us conversation. So it's pretty darn clear, and you're going to hear the stories, that these cuts will drill a hole right through these families and these individuals. But it's not just about them, if you will. This will destabilize our states, frankly, our country's entire healthcare system. So it will not stop just at hurting the families who are, say, enrolled in Medicaid. It will hurt the much broader universe of folks who rely on New Jersey's community health centers, hospitals, nursing homes, on and on and on. They will likely cause layoffs, forced closures of healthcare facilities that will hurt our healthcare workforce for sure. And by the way, they've always been one of the great sources of pride in our state and in our country at the front line. We never saw it more tangibly than during the COVID overwhelming experience. And sadly, the folks who voted for this bill, they knew exactly the consequences. This is not going to be like a year or two from now, somebody could say, wait a minute, I didn't realize that was going to happen. Everything I've just said is clear as a bell, that it will all happen. So nobody who voted yes, including the 3 folks in our House delegation, can ever say, you know what, I just didn't realize this was where it was headed, because they know exactly where this is headed, which makes this vote so cruel, so sad, so disappointing. Enough of the soapbox. Deep thanks again, most importantly, to the folks who have come out today, and family members and caregivers who are showing so much courage every day, but including this day. Let me ask Sarah, to my right, again, the Commissioner of the Department of Human Services, very briefly, what have I missed in terms of the impacts, particularly on the potential, or likely at this point, federal Medicaid cuts? Thank you, Sarah.
You, Governor.